Hello, welcome to the Gut Hormone and Metabolism Connection. I'm Dr. True, and we are in Module 6, completing our gut restoration roadmap. Let's get started. This is a very exciting and interesting module to me, and I love it. I spent a lot of time on this, and I borrowed this from Dr. Mamie Burris to really give you the hierarchy of the hormones, and so you could see that there's an important there's a way in which you want to assess hormone, and this kind of captures that. The hormone that's going to really matter most for our purposes inside of like how does this relate to gut health and how does it relate to the chronic diseases that we as a general population are dealing with. So the first one is going to be insulin. Okay, that insulin regulate our blood sugar. And then there's the adrenal hormone, cortisol. This is the stress hormone that help us really deal with the stressors that we experience in life. And then there's thyroid hormones, and then there's sex hormones. So the way that we want to approach this is that when we have dysfunction that we call hormonal dysfunction. So a lot of times when we say hormone imbalances, it really doesn't tell you a lot. And this term is really thrown around inappropriately sometimes, but for good reasons. Is because it is hormone, but when we say hormone imbalance, we got to really understand like how hormones really work. And that's really my intention today, is really to kind of break down these important hormones. Now, there's a lot of other hormones out there, but we're just going to focus on these 4 hormones, as these are the most impacted by the gut health. And just from knowing these 4 hormones, you're going to be able to really be able to distinguish a lot of the dysfunction that is happening to your system and what you can do about it. So first of all, we're going to talk about insulin, because this is the foundational hormone, because it's really important that you understand how insulin regulate blood sugar and then how it can develop dysfunction due to gut dysfunction. So insulin facilitates the uptake of glucose or sugar from the bloodstream into the cells throughout the body, primarily in our muscles, our liver, and our fat cells. This process lowers blood sugar levels and provides cells with energy, this is why we have glucose used as energy source for the cells. Well, when we consume food, right, and especially food that has some kind of carbs. So when we say sugar, most people think like, oh, I don't eat a lot of sugar. Well, carbohydrates, like simple carbohydrates, like flour, rice, corn, fruits that has a lot of sugar. So sugar from fruits are more like fructose, but they are broken down into sugar when we consume them. So these food, they may look like they're not sugar when they're just food, but once we consume them, our gut will break them down, and then the compound that actually gets absorbed is sugar. So all of these foods that we consume, especially highly processed foods, they are very high in glucose. So knowing your source, right, of food that leads to sugar is going to be important, because this is where a lot of people misunderstand how sugar works, and that this is why simple carbs, processed carbs, and starchy carbs, they actually convert into sugar. So once you consume the food, we absorb the sugar. The sugar goes to go through the bloodstream, and then it gets delivered to the organs and all the tissues and our muscles so that we can utilize them. And on the cell, if you look at the image that I have here for you, this is a picture of a cell. Well, when there is blood sugar in the bloodstream, in the serum, pretty much you will have your pancreas will start to produce insulin in response to the amount of sugar that just came into your system. Well, this insulin, once it's produced, it travels around the bodies to your tissue, and then it'll bind to the cell that says, so you can look at the insulin receptor here, the insulin binds to the cell. This binding of the cell will send a signal into the cell that says, hey, we have a lot of sugar, you need energy, so open up the channel, the glucose channel. Usually it's called a GLUT4 channel. So then open this channel up so that the sugar or the glucose in the bloodstream can go into the cell, and then you can utilize it for energy. Well, when you're healthy, when this system works, then it works well, right? But the problem comes from when you have insulin resistance. And most of you may have heard of this, but basically insulin resistance is when the cell, when insulin binds to that cell, it no longer, it doesn't listen. The cell's like, I'm not going to listen to you. I'm not going to open the so with insulin resistance, the insulin will bind to the cell, but the cell's like, I'm busy. Usually it's because the cell is inflamed. So you see the cell membrane here. This is the cell membrane. That's the covering of the cell. This cell membrane is very unique in that it has a lot of different receptors, not just insulin, but for the purpose of what we're talking about, you only see an isolated model here. But imagine this cell is a very dynamic system. It has multiple receptors on them. So if it's busy dealing with something else, like say inflammation, typically when you're dealing with cellular inflammation, the cells themselves change shape. So this beautiful round shape usually is not there anymore. So it'll change shape, and the cell membrane will become less fluid, less permeable, and very rigid. And that rigidity will prevent not only insulin from binding to the cell properly, but other hormones will also have problem binding to the cell properly. And it's called hormone resistance. And that's really what insulin resistance is, right? But when that doesn't happen, guess what? There's a whole bunch of glucose laying around in the bloodstream, and the cells are hungry. It's like, I don't have any blood sugar, but I can't take in any of the sugar out there. So then the cells will send signal that it's starving while the sugar is sitting out there not being used, and continue to elevate. And then that signal to the pancreas and said, hey, we still have so many different like sugar out there. We need to bring this down. So the pancreas will pump out more insulin. So then you end up with more insulin in the bloodstream, which then as insulin as a function, it actually will stimulate you to gain weight, store fat, and then pretty much this is how you develop excess belly fat, especially visceral fat, which is the deeper layer of the fat that covers your organs. And then there's, which is different than subcutaneous fat, which is right under your skin. And the two types of fat cause different issues, right? The visceral fat is very inflammatory. So then you're going to have issues with inflammation when you have a lot of excess visceral fat. And that can actually be associated with liver inflammation, fatty liver. So, and then the obesity that we deal with, it comes a lot with the visceral fat. Now, subcutaneous fat, I just want to mention here, is more due to, there's cortisol. So cortisol, when it tries to store fat, it will store your fat as subcutaneous fat because it is more easily accessible in times of hunger, that you can just break down those fat really fast. And so cortisol would do that when we deal with chronic stress. The body, as a response, as a defense mechanism, will think that, well, you know, seems like I'm stressed out. And the biggest thing about us trying to stay alive is that we need to have access to energy. So the cortisol will actually convert muscle, which can break down muscle. Like this is chronic stress or chronic high elevated cortisol, will convert the muscle, mostly your legs and your butt, break them down and then store them as subcutaneous fat. So in case you need them, in case of times where you need to run or fight something, trying to escape something, you would then be able to break down the subcutaneous fat very quickly. And that's how we store fat. But insulin, unfortunately, is one that will store, once it's high, it will store the blood sugar in your liver. And that's really why you actually have a lot of liver dysfunction when you have blood sugar dysfunction. And then that will then lead to storing fatty when you store so much sugar in the liver, it can actually turn into fatty liver. Okay, so that's one way that we can end up with fatty liver. But I want you to understand this, because a lot of us in modern time is dealing with insulin resistance. But we historically thought that it's only through food, right? If you eat too much, if you're someone who eat a lot, it's not. It's actually not just from consuming food. So all the things I shared with you about gut dysfunction, leaky gut, hidden infection, toxicity, they can actually cause inflammation to the cell. So it's not just you're someone who overeating, you can still develop insulin resistance if you have hidden infection, gut issues, or hidden toxicity, right? So that's what you need to know about insulin resistance. Now, some of the signs that you want to look at when it comes to insulin resistance is if you have a waistline of 40-inch or more in men, and then if it's a woman, it's a 35-inch of the waistline for more or more. Now, there's also a ratio in which is the hip to waist, waist to hip ratio. For women, if it's greater than 0.8, that's also considered part of like the whole insulin resistance picture. And then men is 0.9. If you see a lot of skin tags, those are signs of insulin resistance as well. Patches of the dark velvety skin called acanthosis nigricans. So those are dark spots on your neck, armpit, in the groin area. Mostly it's going to be armpit, neck area, and especially in the back. If you see those signs, those are signs that you have insulin resistance. Now, there's also darkened skin under the arms or the back of the neck, which is the same, similar here. Irregular menstrual cycle can also be a sign of insulin resistance, but not so much because of insulin itself, but it's because there is a syndrome. Like there's just a set of different symptoms and signs that show up when you have insulin resistance. One of them is irregular menstrual cycle. You can also have abnormal hair growth, like darkening of the hair, especially on the lip area, or excess hair growth. This condition is also known as hirsutism in PCOS, right? Other signs of insulin resistance would show up as maybe high blood pressure, fasting blood glucose. So your morning glucose is greater than 100, fasting triglyceride, which is where you will go and you get your blood work, and it's over 150. So triglyceride is one of those markers that I use to be able to see if my patient actually follows the nutrition plan that I have for them or not. Typically, if it's greater than 100, I'm already like, hey, we need to really be careful, because this is the consumption of processed foods, of carbohydrates, and unhealthy fats like bad oils, right? And then HDL, which is your good cholesterol, they're good because they're large. They don't bind and form plaques easily. If it's lower than 40, then your risk of insulin resistance is really high. That's 40 for men, 50 for women. And then the insulin resistance can also cause damage to tiny blood vessels that in the back of your eyes, but also in the kidneys, in the brain, in the heart, any organ that has a lot of blood supplies to them that are tiny blood vessels, they risk being damaged. Okay, so with insulin resistance, if you look at the sign of insulin resistance over here, these are things that you would also see: tend to be overweight, trouble losing weight, right? You have a large appetite because that insulin. There's other hormones at play here. I'm only talking about insulin, but there's ghrelin, there's leptin. Those are hormones that regulate how full you are after you eat, or how hungry you are when you're not eating. And so there's an orchestra of hormone working together. We tend to try to break things down and just blame everything on insulin. But when there is insulin resistance, most likely those other hormones are also not working as well. Like there's leptin and ghrelin resistance as well. So that's how some people can't tell when they're full after they eat, right? And then sometimes people can't tell that they're hungry. So these are hormone dysfunction that you really need to understand, at least at the basic level, so that you can understand how it's really impacting you in the process of disease development. If you're craving sweets after meals, that's a sign of insulin resistance, or eating sweets do not relieve your sweet cravings, or you feeling more tired after meals. Now, this is pretty typical because insulin, when it why you feeling tired after meals is that your blood glucose would go up right after you eat, and then insulin's supposed to follow right after to bring down the blood sugar. But because your body's not really listening to the insulin so much, that the pancreas keeps pumping out insulin, and by the time the body's listening, there is a massive amount of insulin already in the bloodstream, and that will bring down your blood glucose super low, making you feel like, wow, I'm super hungry, let me eat again. So it's a vicious cycle when that happens, and that's why you have this cycle of like, you eat, then you get tired, get more hungry, you eat again. So that this is why we constantly eat too much, is part of the process of insulin really not working properly. You can have frequent thirst and the urge to urinate. This is where you have too much sugar in the system that will, most of the sugar, if it doesn't have anywhere to go, it will leave through the kidneys. And then when you pull when there's sugar in the kidneys, sugar is a solute, so then it'll pull water into the kidneys, and now you're basically having to pee everything out. And obviously, if you have diabetes, then that's going to be another problem, that now your kidneys can be damaged by these sugar that are pretty much there chronically, right? You can also have hormone problem, PCOS. When PCOS is a diagnosis that kind of is an umbrella term that covers like sex hormone imbalance, insulin resistance, and cortisol problem. Females, you could have estrogen or testosterone dominance from insulin resistance. Male, you can have low testosterone. Other symptoms include skin symptoms, so you can have acne, skin tags, skin pigmentation, so your skin getting darker, right? Or you have high blood pressure and high triglycerides, like I mentioned earlier. So if you have these symptoms or signs of insulin resistance, you can actually do lab testing. I typically test for insulin level. And when you look for insulin, the range in the reference range is like 6 to 24. But the optimal range, functional range is, I'm sorry, I think it's 3 to 24, but the optimal range is you really want to be around 3 to 6, because anything higher than that are early signs of insulin resistance, which you don't want anyway. And you really don't want to have elevated level of insulin, because if you do, you will have a hard time losing weight, because insulin is a growth hormone. So it stimulates things to grow, not for things to break down. So if you want to lose weight, you really have to optimize your insulin level to be lower than 6. I also check for hemoglobin A1C, which is your average blood sugar in the past 3 months. And then you have a fasting blood glucose level, that can also see if you like, how does your blood sugar behave after 8 to 10 hours of fasting, of not eating. And then with those things, I also check for high sensitive CRP, because those can indicate systemic arterial inflammation, which doesn't which kind of give me the whole, like a bigger picture of how to assess the person's along with the blood sugar and the insulin level. I also usually would check for an NMR lipoprotein panel, which is an advanced cholesterol panel, that also give me the score of like, hey, this person insulin resistance score is greater than 45, which is very much dysfunctional. And then you can tell objectively based on the lab as well. Okay, now we're gonna move to cortisol, sex hormones, and I want to share this with you because I want you to understand how these hormones are produced. So cholesterol is actually the precursor to making progesterone. That's a women hormone. right? It's also a precursor to DHEA. Now, DHEA will convert to testosterone and androstenedione. These are androgens that will then eventually turn into estrogen. And we have three forms of estrogen: estrone, estradiol, and estriol, right? And then you could see over here, the 17-OH progesterone will convert to cortisol. A really cool thing that I learned in functional medicine is that when you are dealing with chronic stress and your body has been pumping out massive amount of cortisone or cortisol, you can go, and cortisol, as you could see, they come from the same precursor. So, and this is a really cool defense mechanism in a sense that when you are so stressed out, your body will say, well, you are not fit to reproduce right now. Right now, it is more important to deal with the stressor, survive, not die. So let me shut down the sex hormone production because we don't need to have children right now. And this is when your body is in a state where it's like, I can't do anything anymore. I'm in a burnout state. It is not important to reproduce. It is more important that I preserve myself. Then your body will go through what they call a cortisol steal syndrome, where the cortisol production will be favored, and all the resources that are used to produce sex hormones will be stopped so that your body can continue producing cortisol, as cortisol is the main hormone that can keep you alive. And in that place, when your body is in that state where it's like, hey, I need to stay alive, it will, and then cortisol keeps going up, your body will now break down all the protein, all the muscles. So mainly the big muscles in the thighs and the legs and the butt. And this is where you can see that as those muscles are being broken down, your legs and your butt will get skinnier. And then the cortisol will dump all of that fat to, guess what? Your gut. And this is one of those body types that if you have a big gut and your legs and your butt is getting skinnier, those are signs that you're dealing with chronic elevated cortisol problem, but also you're about to go into burnout state because your system is just has been compensating so much. It is doing everything that it can. And then now you're going to continue to break down muscles, which then will cause atrophy. But now you're just gaining all the weight in the gut. But guess what? I mentioned earlier, all the fat that is being dumped onto the gut is, a lot of it is subcutaneous fat, but typically the person will also be dealing with insulin resistance. So then there's also an increase of visceral fat as well. And this is how, over a long period of time of stress, and this happens to most of us during our 30s and our 40s, because that's the time where most of us have children. So children is a big source of stress, right? We finish college, we're building our career, we're buying homes, we're taking care and building our family. And then as we go into our 40s, most of us will have aging parents that we have to start to care for. And these are things that really are chronic stressors that we all tend to deal with as a general society. And then add in there, difficulty with economy, you lose your job, or the finances become hard, or divorces, or losing parents, right? Our parents pass away. These are major stressors in our lives that then can further drive the cortisol response into what we call, when the cortisol goes up too high, it's compensating. And then eventually you're going to run out of resources. You're not going to be able to deal with the stressor anymore. And that's where most of us start to experience burnout. And then burnout is when you start to have really just irritability. I'm jumping ahead here, so let me go back and go over the cortisol component, and then we'll continue with all the dysfunction. But I wanted to share that with you because that was so fascinating to me. Even as a doctor, we were not taught that. And it's really when I look at and I study function, then I start to understand why all these hormones are so important to understand their function and their dysfunction, like what happens when we have dysfunction. And that's how functional medicine is very effective at treating these hormone imbalances, because we're not really trying to, just put a Band-Aid on it, but we're really trying to understand what is the root cause of why you're so stressed out, why you have all these inflammation. And then, so cortisol is the hormone produced by the adrenal gland, which is like these triangular fatty glands that sits above the kidneys. It is often referred to as the stress hormone because it is released in response to physical or emotional or mental stress. And dysfunction from cortisol could be low or high. And there's different stages of dysfunction in cortisol dysregulation. But if you look at the function of cortisol, so when there is a stress response, which is something acute, which happens and then it goes away, right? So when our brain, with our senses, we can detect that there is a stressor and it has to be perceived stress. So if it is something that is not stressful to me, but is stressful to you, it will not affect me as it would with you. So it is very important that you understand that it is perceived stress. And that's why we can learn to manage stress by changing our perception of how things are in our lives. And perception is pretty decisive because how we perceive something is the context in which we respond to with our body, but also, with our intelligence and how we know to respond to situation. But keep in mind, perceived stress will then will cause the release of adrenocorticotropic hormone, ACTH. This ACTH will then travel very quickly to the adrenals to then release cortisol. Cortisol gets released into the bloodstream, and then cortisol will then go to the different organs to exert its function on these organs. So in the liver, the cortisol will tell the liver to convert glycogen to glucose. So when you're stressed out, or why the body thinks that you need glucose during times of stress, is because historically, that is what stresses us out, is when we are hungry or when we are in danger by fighting with another tribe or being chased by a tiger or some kind of dangerous animal. Well, that stress response is very primitive and it hasn't changed much. But modern time, someone saying something to us is stressful, or that deadline for homework or paper or work, or our children being sick, relationship stress. Now imagine all those things being a chronic source of stressor for you. So you're not even in danger and you don't need glucose, but yet your liver release glucose anyway, right? So it's inappropriate. And then the cortisol, when it goes to your vessels, it will increase blood vessel. Why? Increase blood pressure. Why? Because you need a lot of blood to run or to fight. So cortisol is a fight or flight response kind of hormone. So then it will cause your heart rate to be higher. You're going to sweat more. So you can, that's why when you get stressed or really anxious, you start sweating. That's because it's actually an inappropriate response, right? And then faster breathing. So you get more oxygen into your system. And we tend to hyperventilate, right? But when you hyperventilate, it is also a really an inappropriate response. You actually would get more oxygen if you could breathe in deeply, right? And so most of us actually don't breathe very deep, and we breathe very shallow. And so the fast breathing is just a mechanism to help us with that, right? Accelerated heart rate. So now your heart rate is beating faster, and then pumping all the blood into your extremities. So the cool thing about this to me is that it will shunt all the blood supply away from your gut. So when cortisol is high, you don't digest food. So when you're eating and you're stressed out, that's the worst combination, because you're basically, all the blood is shunting to your arms and legs because you're like, hey, you're in danger. You need to be ready to run or to fight, not to digest food. So again, there's a mismatch in what your body needs to do and when your body is dealing with stress. And so my advice here is if you ever were in a fight with your loved ones or in an argument, or you're dealing with just something stressful and it's time to eat, If you can't calm yourself down, if you don't have a way to manage your stress, like deep breathing or a practice to calm down your stress, just don't eat. Walk, go walk. Walking actually brings down stress very quickly, especially if you walk outside in nature. That will bring down your cortisol very quickly. Then you can eat, because if you eat while you're stressed out, you are actually doing yourself a disservice. And that's why cortisol, elevated level of cortisol chronically, can be a cause of leaky gut. And then, so you see, I already kind of jump ahead of myself, digestion, slow down. And then you have tunnel vision, because this is when your pupil really dilate. So you can only see, but you would only see one thing. And it's hard for you to really see the big picture, because you need to just be hyper focused on one thing, which is like get you out of danger. So these are the function of cortisol. And if you understand these function, you're going to know how does your body respond when you are stressed out. And this is useful to understand so that you can learn to manage your stress better by avoiding activities, right? Like I said, don't eat when you're stressed out. So the cortisol gut connection is that the impact on the gut barrier is that the high cortisol level can weaken your intestinal lining, allowing harmful endotoxins from bacteria themselves, food particles can leak into your bloodstream, triggering an immune response and inflammation. This is why you can sometimes feel really tired after a meal, especially after lunch, right? And you remember earlier when I said insulin can do the same thing. So these two things can overlap with each other. Cortisol can also disrupt the microbiome by favoring the growth of harmful bacteria versus beneficial bacteria, leading to gut dysbiosis. It can also alter the gut motility. So like I said earlier, when the cortisol is high, you're shunting all your blood supply to the periphery, not to the gut. So then you're not, and the body just basically shut down your digestive function. And then it can also cause constipation. When you're chronically stressed out, cortisol just in general slow down your digestion, you're going to get constipation. Chronic stress with sustained cortisol elevation can significantly contribute to digestive symptoms like IBS. So same thing, basically, it's like you're just not digesting your food thing, your gut is not moving things along, affecting your bowel movement. But in that process alone can lead to bacterial overgrowth, because you're not moving things along, you're not releasing bile, right? And the bile can't clean up the small intestine, leading to a lot of bacterial overgrowth. So those are the things that really are impacted by cortisol dysfunction. Now, high cortisol symptoms, let's take a look at this, because you can have cortisol imbalances with low cortisol and high cortisol. So in general, high cortisol will lead to weight gain, especially around the abdomen and the face. Cortisol also presents like a lot of inflammation as well. That's why you see like your face get puffier. You're gonna hold on to water weight. So you can look like you're swelling and inflamed. You can have thin, fragile skin that bruises easily and heal very slowly. You can also develop acne, female facial hair, and irregular menstrual cycle, high blood sugar leading to type 2 diabetes. You can have also high blood pressure. Some people can also have low blood pressure. And then osteoporosis and bone fractures. So especially in women, these are things that they deal with the most. Insomnia, how this presents in insomnia is you feeling really tired physically, but your brain is wired. So you're just laying there wanting to go to sleep, but your brain just thinking and planning and worrying. Those are just being wired and wired but tired. And then you also have muscle breakdown, like I said, and this decreases your metabolism. Okay. So low cortisol symptoms, you can have fatigue, weakness, persistent tiredness despite getting a lot of sleep, feeling drained, difficulty concentrating, feeling burnt out is one of the key words with low cortisol. So usually when you have cortisol dysfunction, the first stage is usually your body will try to compensate. You produce a lot of cortisol, and then it's sustainedly high. You feel like you can deal with a lot of things because you have to, and you have cortisol to help you, right? But after a while, and it could be months for some people, but it could be years. So our system is just so intelligent that it can help us. It can deal with chronic stressors for years. But after a while, depending on what you're dealing with and who you are, your constitution and your genetics, you will go into burnout stage. And that's really when the low cortisol symptoms set in. Your body runs out of resources. It can no longer produce cortisol. So that's when you're going to see like burnout symptoms, tired, fatigue. I can't do this anymore. I'm overwhelmed. So those are the things that you will find yourself saying, or, people who are dealing with, they would say those things. Muscle weakness because of the loss of muscle mass and strength, making it difficult to perform everyday activities. Some women, like, they have problem with just opening jars. Like, those are things that you really want to start paying attention to, right? Especially as we get older. These symptoms are just more prominent when you get older. You can also have low blood pressure, which can cause dizziness, lightheadedness, and fainting. Now, most people don't really check their blood pressure at home, right? But they would have these odd symptoms that come on and they don't know why. Well, this is the reason. It's like they may be entering into burnout state of low cortisol and really severe salt craving, because salt, the cortisol is actually a salt. It is made there, the compound itself has a salt component to it. And so that's why these people will very much crave salt, which if you consume too much, can lead to, dysfunction with electrolytes as well. But low cortisol can contribute to electrolyte imbalances, and that's why it leads to salt craving. Other symptoms of low cortisol is depression and anxiety, mood changes, irritability, loss of hope, feelings of hopelessness, right? And low blood sugar level leading to hunger and abdominal and shaking and confusion. And then you can have GI issues like nausea, vomiting, diarrhea, abdominal pain, constipation, bloating can also be a result as well. Delayed wound healing, like getting a bug bite or something like that, and it just stays there for weeks. The redness just stays there. And then increased susceptibility to infection. This is why stress really impact our immune system. It can reduce the amount of white blood cells being produced, right? And other symptoms would be hair loss, irregular menstrual cycle, and changes in skin pigmentation. Now, skin pigmentation is really referring to Addison's disease, which is where you don't have any more cortisol, and then the person will have a really dark skin, and it has to do with the melanin production due to like cortisol dysfunction, but I forgot. So I'm not going to go into details. Okay, now we're going to go and talk about thyroid hormone. All right, thyroid hormones primarily controls the body's metabolism, regulating how quickly the body uses energy by influencing processes like heart rate, temperature, and calorie burning. There are two main hormones, thyroxine, T4, and triiodothyronine, which is T3. T4 is actually produced in the thyroid. Then the T4 has to go to the liver, and then the liver activate the T4 by removing an iodine group and making it T3. Now you have T3 and T4, which then does a negative feedback loop to the brain, telling the brain like, hey, we have enough T4, T3, so lower your TSH. Don't produce any more thyroid stimulating hormone. And that's how the body and the brain controls the amount of T3 and T4 in the system. There's a lot of issues with this in how we, first in conventional medicine, when we assess thyroid, we only look at TSH, which is very outdated and incomplete. What we need to look at is TSH, free T4, free T3, so that you actually see, is your liver converting your T4 into T3? Then there's another hormone called reverse T3. This is where when you are under stress, inflammation, or you have nutrient deficiency, or you have problem with your liver, your body will convert the active T3 into reverse T3, which is an inactive form, which now makes your hormone low functioning. So even though you're producing the right amount of T4 and T3, but if you're dealing with the stress, inflammation, nutrient deficiency, you can now make your hormone not functional. And this is where you can have normal T3, but then your body will say, I need more thyroid. So then it will produce more TSH. So that's why when we assess thyroid hormone, you have to understand the different component of how hormones work throughout the body, not just the TSH level. And this is what's really missing in conventional medicine during my practice. And I appreciate this a lot more because I actually can do something for patients who may look like they don't have any thyroid issues, but they have symptoms of thyroid dysfunction. And when it comes to the gut-thyroid connection, the gut microbiome, the composition, the type of bacteria that live there can impact your thyroid function. An imbalance or dysbiosis in the gut, especially leaky gut. When you have leaky gut, all the toxins that are leaking in, guess what? They will go to the rest of the body. And unfortunately, a fatty tissue like thyroid is going to be impacted by these fatty toxins. So for instance, if you remember lipopolysaccharide, which is an endotoxin on gram-negative bacteria, they are lipo, right? So lipo is fat. So if these fatty toxins, when they leak into your bloodstream, they can travel to the thyroid, lodge into the thyroid and stay there because they're both fatty tissue. Fatty tissue attract each other. Well, now you have these lipopolysaccharide toxins damaging the thyroid, leading to lower thyroid functioning, right? But more importantly, your immune system will start to look at the thyroid and say, well, you don't look normal. You have this LPS complex sticking out. Let me attack it. And then now you have your immune system attacking your thyroid, leading to thyroiditis or Hashimoto's or Graves' disease. And I don't know why, but in conventional medicine, at least during the time that I practice, when we assess for thyroid and we have Hashimoto's, which is an autoimmune disease, we still treat it as if it is a thyroid dysfunction, but we don't treat it like it's an autoimmune disease. And this is why a lot of people with thyroid dysfunction are mistreated or not treated appropriately. And that's why their symptoms persist, oftentimes for years. And that is where I really feel the pain for these people because, you know, when I look at labs, when I was practicing conventional medicine, if I look at their labs and their labs are like not totally abnormal or it's not abnormal enough for me to treat, all I can do was, or all I was trained to do was, hey, I can't put you on anything right now because your labs look okay. So come back in 6 months, we'll retest you. And if it's abnormal, then I can treat you. I mean, like, it's just so, I mean, I didn't know at the time, but that's what I had to do. But now that I know what I know, I'm like, you pretty much just prolonging people's suffering, or I did, and then only be able to treat them when their labs show up as, you know, abnormal. And I feel like, wow, how many people is really suffering from that? And there's millions of women and men that are dealing with that. And that's another reason why I am sharing this course and have created this course for you all, so that you can have more understanding of like these very basic and foundational principles about our health. And then I would hope that you guys would share this with other people in your life, right? And then thyroid dysfunction can also lead to GI symptoms. Like if you have low thyroid, you can have a lot of constipation because thyroid hormone stimulate the function of the gut as well. But if you have a lot of thyroid hormone, you can have diarrhea. So they can cause GI symptoms, and then GI symptoms or GI dysfunction can also cause dysfunction of the thyroid hormone. It's always a bidirectional connection. And that's what I want to leave you guys with. If you guys went through all the modules and look at all the things we've discussed so far, nothing is isolated because everything in our body is functioning in a harmonizing, in an orchestrated way. So there's one thing can lead to other disorders. And so you don't want to isolate system. And so you really want to assess your system with by looking at every component, by looking at yourself holistically, not just like, oh yeah, I have a thyroid problem, let me just fix the thyroid. No, there's other component. And then of course there's micronutrients, though two being, well, actually a couple very important nutrients for thyroid function is iodine, selenium, vitamin A, zinc, vitamin D. And so if you're missing any of those vitamins, and most of us are deficient in vitamin D, you're going to have issues with thyroid production or just thyroid function at the cell. Okay, so when we look at thyroid dysfunction, there's two forms. One is low functioning, which is hypothyroidism, where you have low T3 or low T4, or you can have low conversion of T4 to T3, or you can have low sensitivity or affinity for binding at the cellular level, because these T3, they have to go to the cell and bind to the cell receptor. And if you remember earlier, you can have hormone resistance, like insulin resistance, in the same way you can have thyroid hormone resistance, right? And then nutrient deficiency can really interfere with the way your T3 work and bind to the cells. You can have hyperthyroidism. So hyperthyroidism is when your thyroid is just producing way too much thyroid hormone, like T4. In general, we have a lot more hypothyroid problem than hyperthyroid problem, because hypothyroid problem give you a lot of symptoms like fatigue, weight gain, sluggishness, brain fog. So when you have those symptoms, people tend to do more about it, especially weight gain. That is just the driving symptom for most people to seek out help. Okay. And then you can have autoimmunity that affects the thyroid function. Now you can have normal T4, T3, TSH, and reverse T3, but can still have low thyroid function. Why? Because if there is an attack on your thyroid by your immune system, you can have normal production, but your hormones just in general are not working properly, because there's also a lot of inflammation going on when there is an autoimmune disease at play. Now, Hashimoto's is low or hypothyroid when you have antibodies, which is produced by your immune system against thyroid peroxidase and thyroglobulin, which is these enzymes inside the cell. And so those are signs that you have cellular damage at the thyroid gland. Now, a lot of times what you may have heard, if you have leaky gut, you have leaky thyroid. That's why Hashimoto's is very highly associated with celiac disease or a gluten sensitivity, because of the autoimmunity component. And then Graves' thyroiditis is when your body is producing antibodies against thyroid stimulating antibodies. So these antibodies just stimulate the thyroid to produce hormone. And then there's tritropin receptor antibodies. That means that the antibodies are produced against the receptor, so it's stimulating the receptor as if there is a thyroid hormone binding to it. So both of these conditions are inflammation of the thyroid because of the attack by the immune system. All right, so let's move on to estrogen. Now, when we talk about hormones, most of us jump into like estrogen, testosterone, and progesterone. But as you could see, the previous three hormones that I talked to you about, they actually are more important to assess when you're dealing with health issues, because they affect how estrogen, progesterone, and testosterone are produced. But sex hormones do not really impact the production of insulin or cortisol or thyroid, but those insulin, cortisol, and thyroid all can affect estrogen, progesterone, and testosterone production. That's why this sex hormone is at the top of the pyramid, because they're not the most they're not the one that you want to start with when it comes to hormone imbalances. You want to optimize insulin, cortisol, and thyroid before you do anything to sex hormone, because most of the time your sex hormones will balance by themselves when you address the other three hormones. So let's look at estrogen. As I said, there's three forms of estrogen. So estrone is made in the ovaries prior to menopause, but can also be made in the adrenal glands and fat tissue. So this is really cool. So the ovaries mostly produce estradiol, which is the most abundant form of estrogen that we produce until menopause. Now, estradiol plays the most, they are the most potent form in development during our puberty. So breast development, female fat distribution, reproductive tissue health, bone health, heart health, memory, and cognition. And this is the one that is linked with endometriosis, fibroids, breast and endometrial cancers, and like PMS and menstrual disorders. And then estradiol is produced by the placenta during pregnancy and the least potent form of estrogen. For the sake of what we're talking about, estradiol isn't really relevant. Now, what's really cool is that when a woman goes through perimenopause and menopause, ovaries start to shut down, and it starts to decline in its estrogen production. Well, the adrenals is actually the backup organ for the ovaries. So when you stop producing estradiol in the ovaries, the adrenals will start to produce estrone. And your fat can also produce estrone as well, but most of the time it's the adrenals. Well, if you are going through perimenopause in a time where you're dealing with a lot of stress, so which is like our late 40s, 50s, and early 50s, if you're dealing with a lot of stress, the adrenals will say, well, I don't have any resources. I can't help you. I'm dealing with so much right now. I'm not going to serve as a backup organ for you. So then you're going to have a decline in estradiol and no backup from the adrenals to produce estrone. These women will suffer more hormonal imbalances, symptoms of low estrogen. So their symptoms actually would be worse when they are dealing with stress. And stressors could be mental, emotional, physical, or biochemical stress, which come from hidden infection and high toxic burden. So if you could see that, right? If you're a woman going through perimenopause or menopause, keep that in mind. And men, your wives, when they go through that phase, I guess what I'm asking for is some compassion for your wives, but really it's for you to understand why some women struggle through perimenopause and menopause and some women are not. So that's why stress is such a big player in how we transition into menopause. So how does the gut affect estrogen? So in the liver, estrogen, before it gets released into the bile, estrogen byproducts really is conjugated with glucuronic acid. So a glucuronic acid is added to that waste, the estrogen byproduct or waste product. And now it deactivates the estrogen. Now the estrogen is like, it's not working anymore. So then you release that estrogen with the glucuronic acid to the bile, and then the bile gets released into the gallbladder, and then the gallbladder release the bile into the small intestine when you eat. But when you have a gut microbiome where there is a lot of bacteria that produce this beta glucuronidase enzyme, this beta glucuronidase, right, glucuronidase will break the bond between the estrogen intermediate byproduct and the glucuronic acid. And they do this because these bacteria feed on the glucuronic acid. They think of this as food, but in order to consume this, they need to get rid of the estrogen. So then they produce this enzyme that then get rid of the estrogen and then reactivated it, because now you don't have the glucuronic acid bound to the estrogen to keep it from being active. Isn't that cool? I think this is so fascinating that our body does this. And then there's like a group of bacteria that can that can interfere, but also support how our hormones function. So this group of bacteria that can do that to our estrogen is called the estrobolome. The estrobolome is the collection of bacteria with genes that can metabolize and modulate the body's circulating estrogen. What they do is they produce that beta glucuronidase. So now if you have these estrogen that's supposed to be turned off, now turned back on, guess what? It can get reabsorbed back into, like when it sits in the gut, it gets reabsorbed back into the enterohepatic circulation, and then you bring back that waste estrogen into your systemic circulation, causing the liver to now have to work again to break down those estrogen. So now you can see your toxic load can be impacted by these estrobolome that is in your gut microbiome, right? So this is how we can have estrogen dominance, not just from production, but also from the bacteria that are living in our gut. Fascinating. All right, so what happens when you have imbalances of estrogen? And I focus on estrogen because progesterone doesn't really cause a lot of problem unless you have when you have high estrogen and not enough progesterone. So that is 80% of women deal with that. Just either you have way too much estrogen, which can then lead, and you can tell when a woman has just like extremely high amount of estrogen compared to progesterone, that woman will have very wide hips, right? And they would have a lot of like menstrual cycle issues, heavy menstrual cycle, cramping, acne, right? Fibroids, endometriosis, bloating, water retention, very easily swelling of the legs, and they hold water every time they eat salt, right? So those are signs that you have very high level of estrogen. Now, so when you have high level of estrogen, you can have symptoms, right? Of irregular menstrual cycle, heavy, painful periods, mood swings, weight gain, headaches, acne, bloating, and digestive symptoms. And medical diagnosis of endometriosis, fibroids, and reproductive cancers like breast cancer and endometrial cancer and ovarian cancer are all linked to estrogen. And then you can have low estrogen level, which can lead to sleep issues, mood issues, dry mucosa. So your vaginal area is dry. So atrophy of the muscles down there, low libido, bone loss, and perimenopausal symptoms like hot flashes, waking up in the middle of the night. So these are signs of estrogen imbalances. And then this kind of go over what I just shared with you. I was ahead of myself. The elevated beta glucuronidase levels are associated with PMS symptoms, heavy menstrual cycle, obesity, metabolic syndrome, infertility, endometriosis, mood issues, heart issues, right? In men, if men have high beta glucuronidase, they can have, or that can lead to libido. If the estrogen level is high enough, it can lead to lower libido, sperm quality, low sperm quality, erectile dysfunction, and mood dysfunction as well. Other causes of high estrogen is going to be birth control pills. Sometimes you can, most of us, if we, how did I say? If you have been exposed to birth control, either birth control pills, Nexplanon, which is the implant, or depot shots, those birth controls can actually drive progesterone to be low. So you don't have to have high level of estrogen, but just if your progesterone is low, you can still have symptom of estrogen dominance, even if your estrogen is in normal range. Another factor that you need to know about is xenoestrogens. So xenoestrogens are environmental toxins like plastics that mimic estrogen, but they are 4,000 or 5,000 times more potent than estrogen when it comes to binding to the estrogen receptors on the cells. And they pretty much, once it's bind, it stays there. It doesn't let go like estrogen would. And then it would send an abnormal signal to the cell. This is why some endocrine disruptors are known to cause certain types of cancer, like breast cancer, ovarian cancers, and endometrial cancers. So I talked about like a lot of the hormone imbalances and their function. So what as far as like root causes of gut issues, right? What are causing these imbalances? So number one is dysbiosis, imbalance in the gut microbiome composition, more bad bacteria compared to good bacteria, leaky gut or increased intestinal permeability, right? Hidden infections, intestinal and extra-intestinal. So parasites, bacteria that are in the gut, but also outside of the gut as well. Chronic stress that have led to HPA, HPA axis dysfunction. And then dietary factors, right? Lots of processed foods, lack of fiber, excess sugar or refined carbs are all reasons that would really contribute to hormone imbalances. And then toxin exposure, pesticides, heavy metal, endocrine disruptors, and medication. So medication, antibiotics, birth control pills, and NSAIDs are all drugs that really disrupt the gut, cause a lot of harm to the gut that can also that then result to dysfunction in hormonal production, but also how hormones work at the cellular level as well. So what can you do? What can you do to really minimize your risk, but also deal with some of these things, right? So number one is dietary modification. Fiber is gold. Just think of like, you just need to feed your body with fiber. 25 grams for women, 30 grams for men in general, but you want to give your body a diverse source of fiber, right? So prebiotic containing foods, vegetables, fruits, whole grains, legumes, fermented foods like kefir, yogurt. If you can't do dairy, do coconut yogurt. There's so many options now, right? And definitely while you're eating more of the good food, you also have to cut back on the processed food, sugar and refined carbs. And really, gluten is one of those things that if you can really eliminate it from your diet, great. If not, minimize it by at least 80 to 90%. You're just going to do yourself a lot of favor by just doing that. So probiotic rich fermented foods, prebiotic supplements that nourish the beneficial gut bacteria like inulin, galacto-oligosaccharides, and resistant starches. Resistant starches are, oh man, I can't remember that. Gluconanin is a good resistant starch. Now, those of you who like rice, I don't know how you would enjoy this, but you can cook the rice, cool it down, make it really cold. That rice, all that starchy carbs now become resistant starch. So you can eat cold rice. I don't know if that's enjoyable, but I've tried. It is not something I could do. The other thing is don't overeat. You know, every time we overeat, we stretch out the stomach too much. That's how leaky gut can happen. When you stretch out the stomach and the small intestine so much as food pass through them, now your lining is going to be compromised because you're stretching out the actual anatomy of the cells. And then you want to avoid fat and sugar meals. So donuts, bagel with cream cheese, fried foods like French fries, sweet potato fries. This is because the combination of fat itself causes a lot of the LPS complex to rise after you eat. And then sugar drives your insulin. So you could see that it causes gut dysfunction and inflammation, and it drives up insulin. That is the worst combination you could provide. So instead of doing fat and sugar, you want to do either lots of vegetables, definitely with protein, and then a little bit of good fat here and there, like a little bit butter here and there, but you really don't want to mix fat and sugar together. That's in general is it's just a lot of inflammation and causes a lot of dysfunction. So that's what you want to do as far as dietary support. These are supplemental support. So there's a lot of things you could take, right? But I just named these things here that I use. What we're going to do is we're going to put the supplements together for you to be able to purchase in the advanced program, because these things, you can take them, but I can tell you, they're good for maintenance, but you really need to address the root cause first. Once you address the root cause by removing the source, then you can use these targeted supplement to then continue to kind of maintain your outcome and your results. And lifestyle intervention is stress management. You really have to learn how to manage stress, especially your own emotion. Adequate sleep. I put sleep twice, but sleep and circadian rhythm optimization. So sleep deeply and sleep well. Don't overtrain when you exercise. Also regular movement and exercise, but don't overtrain. Don't overdo it. Don't go out there and like play tennis for 5 hours. Which is what I can do sometimes, and I can feel it. There is actually a negative impact, even though it's beneficial, but when you overdo it, you can cause harm to your body. But more importantly, it's that long duration of cardio. So distance running, when you do too much of that, or when you do HIIT that is too long and too intense, you can actually put your body into overdrive, and it really mostly affect your cortisol. So overtraining and over-exercising will drive up cortisol. And when you're dealing with cortisol dysfunction, that is the last thing you want to add to it, because it is a form of physical stress, right? Or not sleeping, or sleep deprivation, night after night, not getting enough sleep, or sleeping after midnight for a long period of time. You just don't get to recover. So that's why sleep is so important. And then addressing the underlying cause, like I said earlier, you got to treat the gut infections, either it's yeast overgrowth, SIBO. You got to resolve the leaky gut, right? And restore gut barrier function, detox, so that you can eliminate endocrine disruptors. And so these are the things that you really want to look at. I also include a quick reference guide for optimal gut metabolism axis here. Short chain fatty acids, you're going to learn more about these, but also these different polyphenols that you could use to feed your gut microbiome. Eating these foods will increase the bacterial population in your gut that you want to nourish, right? So thank you so much for your listening. I am excited that this is the end of our gut restoration roadmap. And I hope that you guys enjoy this just as much as I did in creating this for you. And I hope that this makes a big difference in your life and the people that you care about, that you would share this with them so that you would make their life better through gut health. Thank you, and I appreciate you, and I will see you soon.